Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, I want to give an update to a video that I made about a week ago when I said that I was starting Bupropion early because of the depression I was feeling associated with my bipolar disorder. I've now finished the first week of therapy with Bupropion or Wellbutrin, so I just want to kind of share my thoughts and my experiences with it up till this point. So the first thing I'll come right out of the gate and say, since I started the medication, my anxiety has kind of gone through the roof. It's something that I've been experiencing very intensely, probably more intense than I've really experienced it in the past. When I made that last video saying how I was starting this medication, I said that I was experiencing thoughts of depression kind of early on, nothing too intense, but I was having some depressive thoughts. And with those thoughts comes anxiety. So I was already experiencing anxiety, but after starting the medication, I could feel it right away in the first 2 days. Anxiety kind of just went way up. And I'm still experiencing that now, but luckily, as you know, if you've watched my other mental health videos, I do have clonazepam to kind of combat that just for these first couple weeks until it kind of levels out and my body gets used to the medication. So as many of you probably know, the big thing with antidepressants is that when you experience most of the side effects associated with them, the side effects kind of happen early on and then taper off as you get used to the medication. And then benefit kind of takes a little bit longer to start, but then rises up kind of opposite as side effects. So side effects start off early on, go down. Benefit kind of takes a little bit of time. So a lot of people stop using the medication while the side effects are kicking in before they have a chance to really experience that benefit. So knowing this, obviously I'm going to keep pushing through these side effects, especially the anxiety, and get to that point where I know I can get maximum benefit, which I'm hoping will be around the 1 month mark. I think I will see some progress along the way, but for me, it's really that first month, I think, is when I'll see some benefit, and I'm basing that off my experience with this medication last winter. Other side effects that I'm experiencing, one would definitely be a rapid heart rate, so tachycardia. I don't know if this is associated with the anxiety, but I do know that this is a side effect that can happen, I believe greater than 10% of the time with bupropion. So I am experiencing that. And also a little bit of dry mouth or xerostomia. With that, I just drink extra water and it kind of gets better throughout the day. But other than those three side effects, so dry mouth, rapid heart rate, and anxiety, I'm not really experiencing any other side effects. So I think I'll be able to successfully push to that 1 month mark like I just talked about. I'm still feeling really good about my decision to start this medication early. I don't know if this is placebo or what it is. Maybe I just feel a little more secure being on it, but I already feel a decrease in the depressive thoughts that I was experiencing. So it's interesting. I don't know if I can get this much benefit in the first week. Some people say you could get 10% benefit in the first week. So maybe I'm experiencing that, but I do notice a decrease in my depressive thoughts that I was experiencing. It's just that anxiety that I really need to go away. Some good news with my therapy. I got a phone call from the psychiatrist office the other day. And I do have an appointment scheduled for October 17th. So that's perfect timing, especially when I just started this medication, making a medication change and experiencing side effects, experiencing changes in the thoughts of depression that I'm experiencing. But these are all things that I can bring to the psychiatrist, and we can have a really rational, good discussion about it and kind of make a plan moving forward. And he may have some suggestions of medication changes I can make, or even dose adjustments I can make to kind of get through this winter better. But overall, it's really good to have him to follow me through this time, just because, like I said in some of my other videos, last winter was really tough. Experienced depression very hard. Well, that's all I really have to share in this video. I just wanted to give you guys a quick update after the first week of using Bupropion or Wellbutrin. Mainly talk about the side effects and the decrease in depressive thoughts that I've been experiencing. And then share that good news with you about having my first psychiatrist appointment so I can kind of get some backup when I'm making these decisions about medication. I'll probably give you guys a 1 month update as well, just to see if the depressive thoughts are completely gone or just where we're at in general. So I'll make that video in 3 weeks' time. Other than that, if you want to help grow the channel, as always, remember you can like the videos, you can share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. All right, that's it for today. Take care.